at hand. And last week I had an expert in actually health and specifically in children. We talked about mental health in children and all this. So today we're looking at just an item that probably also can cause about this kind of cases. And today we are looking at autism. In case most of you have been hearing about this, I'm very sure at the end of this very segment you're going to be knowing in details about autism, the causes, what is autism and all this. And with me, I have an expert in children, a registered nurse, and she is going to be introducing herself. How are you doing?
Hello, Rick.
Good afternoon.
Good
Happy
afternoon.
New Month.
Happy New Month.
How is November starting?
Fair. Very good.
Fairly.
Yes.
Compared to October? Do you remember how it started?
I really cannot tell.
Okay. All right. Welcome to the show. Maybe for the person who is just watching you for the first time, an introduction.
My name is Vanessa Kirabo. I am a registered nurse.
Okay.
Yes, please.
All right. So you being a nurse, last week I had you here and we talked about mental health in children. And actually we talked about depression, stress, and anxiety. Yes. So today we're looking at these cases that really children go through and probably we don't know what to do about it. Or maybe sometimes they go through that but we don't know exactly what it is, and that is about autism in children. But maybe for the person who is so green about it, maybe a breakdown, what is autism? Maybe a simple definition so that somebody can understand.
Well, autism is a neurological development condition.
Okay.
It's actually commonly referred to as autism broad spectrum.
Okay.
Like it's a spectrum, which means it has a variety of characteristics that you can use to define what this condition is.
Okay.
So usually it's a neurological, I beg your pardon, neurological development condition that affects how one perceives the world, society, how they interact with society, and how they communicate with society. So in children, you notice that the way they interact with their peers is different. You'll notice that the way they communicate is different.
It's different.
And then the way they perceive certain environments will be different. So that is autism in children.
Are those some of the symptoms or signs, or there are probably others? How do I get to know this child might be autistic?
Autistic. Well, first of all, there are certain things that you notice in children with autism. Currently, we are having an increase in autistic children in the country because this condition is not very easy to tell that a child is autistic. Some children are highly dependent on, they will need a lot of help, and then some children are autistic but need limited help. They have a bit of dependence. So what happens is these children tend to have communication issues. The number one sign in some of these children is delayed speech.
Delayed speech.
Yes. They also do not know how to interact with certain emotions. They tend to be withdrawn. They cannot, as they grow, you'll notice that they cannot maintain a certain conversation, or they will look away, or they do not know how to understand certain emotions and feelings. Autistic children do not know how to understand affection. You'll notice that when a child is usually hugged by a mother, she shying away or pulls away. Yes, actually she acts, or he or she acts like they're not comfortable with it. So they tend to not be able to behave in the normal say, due to lack of words, according to other children. You notice that the child is behaving in a way that is not what other parents would maybe consider normal. Are there also adults that are autistic? Yes, please. There are times one can have autism, and because the level of autisticness in the body is not very prone, like one does not have so many symptoms that show that they're autistic. So there is a delay in diagnosis. So one can grow up and then they are having a few symptoms, and then maybe one may think this is OCD, the obsessive compulsive disorder, because they like things in a neat way. They tend to have repetitive actions. And then later on they actually realize that this is actually autism. So there are things that you can do. It's a multidisciplinary team. Usually if caught early, this is, by the way, something I forgot to mention in the beginning. This is a lifetime disease. It's a lifetime disease? Yes, please. It's actually a disease? Cure. Yes, please. It has no cure. So, no. Hold on a bit. Like, can somebody just become autistic at like my age? No.
It starts from when you're young.
It starts from when you're young.
Actually,
this, you remember last week when we were talking about causes of mental health diseases, and then we were saying sometimes this is a condition that is led due to parenting. Now, autism cannot happen due to parenting. Autism usually happens because of genetics. If it is not genetics, due to environmental factors.
Okay.
So, for example, if a parent has a genetic mutation that happens in their genotype, they can, if you marry someone who also has the genotype, you can give birth to autistic children. Sometimes if I do get pregnant, for example, and I am exposed to certain toxins, maybe x-rays, radiations, and different toxins during pregnancy, this can predispose me to give birth to a child with autism. Yes, who is autistic.
Okay.
So this is not something that you can acquire. Like right now, I cannot become autistic. No.
Okay.
Usually these are things that are predisposed
but
from
actually,
childhood.
some conditions can make you produce a person who is autistic.
Yes, please.
Okay.
If your genotype, if that's why if you go for genotype screening, they will let you know, in your genotype, there is a certain chromosome that has something that can predispose you to having children that are autistic.
Is it also a cause of kids that delay to walk?
No, actually, you'll notice that these children will reach their milestones very well. They will reach their milestones very well, but the issue is how they behave, it's how they communicate. Now, their communication. You'll notice that they've reached the age of 2 and they are not saying the words that you would expect them to say. Or even when they do speak, they use sounds. You notice this child is always humming or having a different type of sound that they do. Or even when they choose to do something, they will rock back and forth, or they will tend to do any activity repetitively. So you'll notice that it's actually, they'll achieve normal milestones. The child will crawl at the appropriate age, sit at the appropriate age, but then now the behavior, they do not know how to attend even the emotions. They tend to be withdrawn. They do not know how to perceive affection. So some of the things that you would expect a child to do, maybe be clingy to a mother, children that are always, at a certain age, smiling. They do not. Like, you come towards a child and you want to hug, and the child actually gets angry or pulls away.
Or doesn't even realize,
actually remains still, no matter what you do. So their behavior is what actually pulls, and the way they perceive the world. You'll notice maybe there's something that could actually make children laugh. Like, you show them something and it's funny, and then this child just stares blank.
Like normal.
This is so you'll notice their actions.
If you noticed some of the symptoms, or if you go to realize like this child might be going through that, are there possible, okay, you said it's a lifetime thing, but is there any way of trying to at least cover the situation?
Actually, the most important thing is usually when mothers notice certain things about their children, it's very important that they do seek help. Because usually when a child goes ahead and comes to hospital and says, my child is not, she's not speaking, he or she is not speaking, or my child is not behaving like a normal baby, is something that I'm not understanding. Or some of these children that tend to achieve normal milestones or are very healthy, sometimes they may even have a bit of speech happening, but then you'll notice there's some things they do, when they are playing, they tend to line toys in a straight line, or there's something strange you notice about how they play or interact with other children. Or let's say when they're in a group, you know how children play in a group, your child is always in some corner.
Like a side, isolated.
Yes. And they are always doing maybe one repetitive action again and again. If there is one favorite toy, that is the one favorite toy you'll find the child with again and again.
All the time.
Yes, so when you bring the child to hospital and then maybe they see a pediatrician or a doctor, they will refer you to a psychiatrist who will perform a test.
To detect
to determine that whether the child is autistic. This is more detailed. There are a variety of things that they do check to determine that the child is autistic, and what level of autism, and then the type of therapy or type of assistance the child will need.
So if detected
if detected, the children have, it varies on the type of
the level
of condition that the child has, because there are children that need for example, things from speech therapy. They will need to have speech therapy, they will need to have cognitive behavior therapy, something to help them with how they behave. So it depends on how the child is reacting. It's a multidisciplinary team that works with these children. You will notice that they will sometimes need assistance of a dietitian, a nutritionist, because some of the foods will be restricted in these children's diet. Yes, please.
So now, if it's a lifetime thing, you can't get it at this age, what do we do to prevent more kids that of these cases to be produced?
Well,
prevention
is actually quite difficult. Number one, because now, for example, one of the causes of autism is the fact that mothers are predisposed to different toxins during pregnancy. So, one, you could have genotype screening. This is something that is very important with before marriage.
Yes.
It's very important that you do go with your partner, do the normal screening, sickle cell, and any other genetic condition that could be acquired if you do get married, so that you are aware. That could be one way of preventing it. The other is living a very healthy lifestyle while pregnant, ensuring that you attend all your antenatal visits, so that they do monitor the development of the child. And then in case maybe the child is sick, because sometimes when you fall sick and then the child falls sick, they can affect the growth of the child, hence affecting the brain development.
Even the behavior.
Yes, hence affecting, causing the autism to happen. So one of the most important ways is to ensure that a mother has a healthy journey during her pregnancy. This will help prevent the autism. But the fact that this may be very difficult to prevent, the most important thing that I think that should happen is early screening.
Early screening?
Yes, early screening of this condition. Because when a child is screened earlier, their way of life, a child will be autistic for life, but that does not mean that they cannot achieve
a little bit of adjustment.
Actually, what I mean is they cannot achieve what a normal child would achieve, like the achievements that another child would have. These are children that go on with the right therapy and the right treatment, that go on to become useful personnel of the community.
True.
So it's not that when a child is labeled autistic, that does not mean that they cannot be doctors, nurses. No, the autism is not a weakness. So children with autism, they need all the care, they need all the help. So when you notice that the child is autistic, there are some myths that I have heard. People say that, vaccination is what has caused the increase of autism in children. No, it is not true. Because that is, please, we do need to get our children vaccinated. Helps prevent diseases. So when you do notice that the child is autistic, do not listen to myths that the child is going to be a failure, the child is not going to be able to be someone important in life. No. If the child does not speak at 2, that does not mean they will never speak. They do attain the capability to speak. They can go to school with therapy. There are schools in this country that have both autism and the normal syllabus. So they do go to school and they are able to achieve, become doctors, nurses, and all that. So you just need to do early screening so that we can be able to treat them, help them be better, and automatically the families do go through a bit of counseling so that they can understand. For example, mothers, when you have a child and your child is extremely distant, there is a way it affects you, there is a way it does not sit right with you.
Yeah, that is true.
So usually we do counsel these parents. We do counsel these parents and guide them.
Normal kids
yes,
and all
please.
That,
let's say, for example, you have 4 children, but then your last born is a bit autistic. The parenting is going to change, because you need to understand that this child, there are certain things that you would consider abnormal, but to this child, this is normal. You need to be patient with them. They need to be extremely patient with autistic children, but they do recover from some of the symptoms that they have.
So how should parents take care of these kids as we wind up, like how they should accommodate them in that situation of theirs?
Well, that is extremely broad. Because when they do go to hospitals and they see specialists, the speech therapist, the dietitian, every specialist will give you the type of care that you must do. The dietitian, for example, a nutritionist will tell you, you know what, we need to remove sugars from the child's diet. Yes, please. The therapist, the speech therapist, or some of the therapists will tell you, for example, this child is going to have certain activities at this time, and then this is going to be their routine.
Okay.
Because they tend to love routine a lot. They tend to have routine. So if their routine is going to be that in the morning they will have the speech therapist come in, then later on in the day they will attend normal school like any other child, and then later on, so you do not break the routine.
Sounds like it's too much work.
No, actually, that is one thing that I would like to eradicate. It is not an easy job.
Okay.
That is the truth. Having an autistic child is not an easy job, but that's why you see we do not only care about the child. We go ahead and, for example, there are group therapy sessions where autistic parents in this country, I know 1 or 2, have come up with groups so that they can communicate with each other. You know, when you know how your child is behaving and then you say, oh, my child does this, how are you handling it? Or you just a place where you can communicate. So it's not easy. It is not, I would not want to label it as too much work, but when you are informed, you gain knowledge, and that way you can know what to do about it. And like I have said,
best for your child, that means definitely you
exactly.
go through that. Okay.
And like I have said, these children they can become doctors, nurses. The next president could be autistic. Who knows? So it's just giving them the right support. And the parents we do continuously support the parents, ask them what is the new challenge you are having right now. Is there any other place that you would feel you would need to understand better?
Okay.
Yes, but
does being autistic make somebody's body immunity like weak, or it can stay normal?
No. Right now, the only issue we have with autism is the way they behave, the way they perceive the world, and their emotions.
Okay, so like it only affects the behavior, emotions, communication, but everything remains the same.
The child will be normal. You're not going to find that we are saying now bring the child to hospital for there are different diseases that the child will have because they are autistic. No. This is a normal child. The only difference is I don't like labeling it as abnormal behavior because to them that is normal. They will just behave differently,
a little bit differently
from what another child. You will notice that they have. When you look, some of the autistic children, most of the autistic children, some of them do not have features that you can see. I will put an autistic child in front of you.
They look normal.
And you'll see physically normal. The only issue is when you notice that he will have a certain routine or a certain pattern of behavior, or you've brought him a birthday party.
About behavior, is it because sometimes I feel also the child might be normal by birth, but because of the upbringing, the parents are too tough. So maybe it might change the behavior of the child, behaving shy.
Autism, the autistic children, their behavior is quite distinguished from and like I have told you, the raising of a child cannot predispose a child to autism. Usually it is genetic or something happened, an environmental factor. A mother was predisposed to something during pregnancy. Something happened with a genotype that affected the brain development, causing this autistic gene to appear.
Well, so maybe a piece of advice to parents out there as we wind up, maybe in the last say to the people that are living in the society with this kind of people, or maybe you never know, your next child might go through this, or maybe you don't want them to go through this. Maybe just a last say for that.
Well, the last thing that I would have to say is an encouragement, actually.
Okay.
These autistic children are beautiful, amazing children.
Wow.
They are actually, according to me, I find them very, very intelligent.
According to you?
Yes, I find they tend to do things that are I find some of their patterns actually intelligent. So these are children that deserve all the love that you could give to any normal child. These are normal children. They are still children, and like I have said, they just behave differently, not abnormally. So the fact that someone is different does not mean that they do not deserve the same treatment. Just because I am light-skinned and you're darker does not change that we are all... True. Yes. So I would like to encourage any parent out there that has an autistic child and tell them they are doing a great work, because I know it's not an easy task, but they're doing something amazing and powerful. Let them keep it up. When they have challenges, let them always communicate about it. And there is no situation that they cannot overcome with autistic children.
Okay.
There are some that I know, some autistic children are really, really not well.
Okay.
But still, I believe with the care, with the right care, they do get better. Their prognosis improves.
Wow.
So just to encourage
So if
them.
I told you you're autistic, is it an abuse?
Well, that would be, it's not an abuse, but that is not something that, you know, it's actually, autism is you know, I believe autism is a strength. Like, I would not want a child to ever think that because they're autistic that they are not strong enough to achieve anything.
Okay.
So like, I have labeled them. They are beautiful, amazing children that can do anything, and intelligent, that can do anything that they put their mind to it. I know in the beginning steps, when the child is not speaking, when the child is not being able to react with other children, it can be challenging.
Okay.
But these are normal children that can achieve anything they put their mind to it with the right help. So may the parents continue to, you know, be there. Be there for the parents and continue to do therapy. Yes, please.
All right, thank you so much, and I'm very sure for the person who is watching out there, you have at least got, you know, the detailed part of it, and also the prevention measures. Prevention is always better than cure. Yes. And maybe in case there is that case of autism, you can also be of help to a neighbor's child, your child, or to the society of this kind of people out there. Thank you so much for passing through.
Thank you.
And I am sure next time we shall touch about some other case.
Yes, please.
Because actually, autism looks minor, but common.
Yes, currently it is common.
That is true.
Yes, please.
Okay, let's go for this one. Then, of course, when we return, I have more still on the lunch bite.